Now we're going to hear from Pat Neal. She's an RN with 34 years of diversified nursing experience at MD Anderson and is currently the clinical care coordinator for the sarcoma center here. She is a primary nurse for Dr. Trent with a primary focus in the treatment of GIST patients, and she's going to talk on managing the side effects of treatments. So, Pat.
Thank you, and thank you for having me back again this year to talk to you. It's a pleasure to see you all here. So we're going to talk a little bit about the different NIBs, first of all. I'm going to show you pictures of them. We're going to run through them fairly quickly so we can get to the general side effect management. First of all is Gleevec. I know most of you are familiar with this drug. It comes in two strengths, the 400 and the 100 milligrams. Some of the common side effects you'll see with Gleevec are fluid retention, vomiting, muscle cramps, bone pain, diarrhea, fatigue, nausea, rash. I've had a couple of you talk to me about rashes today already, abdominal pain, and hemorrhage. We're going to go in depth in each one as we go a little bit further in the talk. So Gleevec should be taken with food. I recommend you take it after a full meal. Now that kind of contradicts a lot of the things Sarah just said to you. And with a large glass of water. Now if you've had a gastric bypass or you had part of your stomach removed, that's not possible, okay? So in that case, we may need to look at how we're dosing the Gleevec. You may not be able to take 400 milligrams at one time. You may have to indeed break that dose down, so you take 200 at a time and intersperse those with your 6 small meals. But that's something you will discuss with your doctor and your team as to how best to take your Gleevec. With Gleevec, you cannot have Tylenol because it interferes with and competes with that binding site that Dr. Trent showed you on his slides. No St. John's wort. Got to watch if you're on Coumadin. Please tell your physicians if you're on anticoagulants because it, again, will interfere with the absorption and the binding. Avoid grapefruit and grapefruit juice. If you take grapefruit or grapefruit juice, it's going to increase your Gleevec blood level. So you will have more side effects, okay? Novartis recommends that if you're on the 800 that you're not using the 100 milligram tablets because they have more iron in them. The 100 milligram tablets have more iron than 4 100s have more iron in them than 1 400, okay? I've argued with Novartis about this at a couple of the meetings since my patients all need to be on iron. I'm not sure this is necessarily a bad thing, okay? We don't know a lot of the risks. Should you become pregnant or should your spouse become pregnant on this drug, okay? There are some anecdotal responses, but again, if you are of childbearing age, this is something you need to discuss with your physician, as with all the NIBs. Here's Sutent. Okay. Common side effects from Sutent, again, fatigue, diarrhea, nausea, vomiting, rash. This is the drug where we get into the hand-foot syndrome, and I'll have some pictures of that in just a minute. This drug causes hypertension, as many of you all know. So we watch your blood pressures very carefully, and we often refer you to cardiology so that they can monitor your blood pressures. Because our patients don't come to us with no other medical problems. A lot of patients come to us, they already have heart disease, they have coronary artery disease, and they're on other drugs from their cardiologist and for many other reasons. So we need to bring in a whole team to manage this. Stomatitis, you can get actual sores in your mouth from the Sutent, and with this drug you can also have some low blood counts. Hypothyroidism. So we do check thyroid levels on patients on Sutent, especially if you're complaining about fatigue, being cold all the time, things of that nature. It's important that we check those levels. Sutent, again, now this drug can be taken with or without food, okay? Again, no St. John's wort, and please talk to your physician about all your prescriptions. The best thing to do is put them all in a bag, bring them. Everything that you have in your medicine cabinet, whether you're taking it or not, just bring it in a bag so that we have all the correct doses down when you come, okay? Again, no grapefruit juice, and watch that birth control on this one also. Nexavar or Sorafenib. Now you see all these nibs get very confusing. Sunitinib, Sorafenib, and as we move into all the new ones. So I like to use the trade names because I think it's a little bit easier. But you'll see the side effects are very common. The profile of side effects are common. Nexavar, fatigue, weight loss, hand-foot syndrome, loss of hair on Nexavar. Okay, that's not as common with the Gleevec or the Sutent. Diarrhea, loss of appetite, nausea, abdominal pain, and again, high blood pressure. Now, Nexavar, you take without food, 1 hour before or 2 hours after eating. Now, if you're eating 6 small meals a day, this becomes a very challenge. You're going to schedule your meals as well as your food. You have to swallow it whole. You cannot chew it, break it, or crush it. Okay, you take it with a full glass of water and no St. John's wort, please. Okay? And again, let your healthcare team review your entire list of medications, over the counter and prescription. Okay, it's extremely important. The new drug Tasigna. Okay, this was touted as the super Gleevec. Okay, what are some of the side effects? It does cause a low blood count, rash, nausea, headache, fatigue. Again, diarrhea or constipation. You see a lot of itching with this drug, and there are some Q wave changes. So with this drug, you will either see the cardiologist or you will be getting periodic EKGs just to watch what the Q wave is doing. It's not something you would necessarily be symptomatic of or aware of, but it would be something we would detect on your EKGs. With the Tasigna, again, this one you have to take on an empty stomach 1 hour before or 2 hours after meals. Now this one contains lactose. Are you lactose intolerant? Again, you need to discuss this with your healthcare team. Okay? You take it with a full glass of water. The beauty of the way this drug is packaged, it's packaged in a blister pack so that it prompts you to take your medication correctly. 2 in the morning, 2 at night. So it doesn't give you any qualms. You know if you've taken your morning dose. For those of you on the Gleevec and the other drugs, I recommend that you get a pill box. Fill that for a week so that you know. Because the call I hate on Friday afternoon at 4 o'clock is, I don't know if I took my medicine this morning. I don't know either. That's the problem. So if you have that little pill box and you can look, oh, my morning dose is still here, I didn't take it, you can take it. So use those pill boxes. You can buy them at the dollar store. I don't care where you get them, but it is really a godsend, okay? You will have periodic EKGs with this, okay? Please tell us, with this drug especially, all your medications, and again, no grapefruit juice. So just forget grapefruit. Grapefruit is out of your life, okay? All right, Sprycel or Dasatinib. This one causes swelling, anemia, lightheadedness, headache, cough, abdominal pain, nausea, vomiting, fever, rash, muscle pain. This one you have to avoid the antacids. Again, no grapefruit juice. And this one also has the lactose in it. I've had a lot of complaints from patients who are known lactose intolerant. And how do I tolerate that? Can I take Lactaid? We're not seeing that that's helping a whole lot, but you can try it. But if you're on this drug, be sure you're not taking any other sources of lactose. No ice cream, no cheesecake, no milk. Those things go away with this drug because you can usually tolerate a small amount of lactose, and you can get by with what's in the medication if you don't have any other extrinsic sources of it. Okay? This one, they be sure that pregnant females don't handle these capsules if they're crushed or broken because there's some skin absorption if you touch it. okay? Luckily, most of our patients that are on these drugs are past childbearing age, but not all, okay? All right, now we're going to talk about some of the side effects. Fatigue. Yeah. So what is fatigue? You all know better than I do what is fatigue. You're tired. You're physically and mentally tired. It's a weak feeling over your entire body. You wake up tired after you've slept. You have no motivation to do anything. You can't concentrate. You have no energy. And the last one, you're anxious, you're nervous, and you're fussing at that spouse because they're the ones that are closest to you and the safest for you to fuss at. Okay? It's not an isolated symptom. Okay? It doesn't occur all by itself. There are many potential causes, and we could spend a whole weekend talking about fatigue and its causes. Most common, you have to rule out anemia. Do you have a good nutrition? Are you in pain? Are you taking pain medicines? Are you on morphine or pain medicines that are going to make you tired and fatigued? Are you depressed? Depression is one of the most difficult symptom. If you don't tell us you're depressed or if you're experiencing these symptoms, we may not necessarily know that, but you will know that. And if you are on an antidepressant, it can help you so much in your life and your ability to tolerate these medications and your diseases. Are you sleeping at night? Or are you going to sleep and you're waking up in an hour and your mind is racing and you can't go back to sleep? You know, do you need a sleep medication? You have to let us know. Unfortunately, in this country, we can't put video cams in everybody's room so we can watch you. You know, we'd learn a lot if we could, but we can't do that. It's illegal. So you have to tell us. We rely on you to report us. And don't think that, you know, any symptom is too small to let us know. We need to know what's going on so we can help you, because we can manage a lot of these side effects if we just know. Hypothyroidism. It's a simple test. It's a simple blood test. It's drawn with the rest of your blood work. And the difference of being on a thyroid supplement can make the difference between night and day. Okay? What do we do to prevent it? You prioritize your activities. Put the things within easy reach. Okay, if they need to move down a shelf, do so. Drink as much fluid as you can. Eat a well-balanced diet. Here we go with that buzzword, protein. Exercise, like Sarah said. Don't want you to be couch potatoes. There are things that you need to do each day. It may just be going out to the mailbox and getting the mail, walking the dog, whatever. But balance it. What is the most important thing you have to do that day? And make that your priority. And that may be going to something at your child's school. It may be going to a concert. It may be going to a movie. That is more important at that point in your life than sweeping the kitchen floor. Because no one has died because their kitchen floor has not been swept for 3 days. Okay? Keep a fatigue journal. If you need Dr. Trent to write that note for you, he will. Okay? You do not have to sweep your floor or vacuum. Okay. Rash. What do we do to treat the rash? Mild antihistamines like Benadryl cream, topical steroids. Sometimes we have to rely on oral steroids that you have to take by mouth. If it becomes severe, we may need to do a dose adjustment on your medications. We found that rashes are more common in females, and it appears to be related to the dose of the medications that you're on. So keep a record of when you got it. Also keep a record, did you change your laundry detergents? Have you changed soaps? Have you changed whatever? Okay? Hand-foot syndrome. These are actual patients. I think these were Sutent patients, especially the foot. Okay, what are some of the symptoms? Burning, tingling, redness, flaking, and sores. Okay, hard calluses develop. So what do you do to prevent it? Prevent the friction. Okay, you need to wear good fitting shoes, not flip-flops, no walking barefoot. Okay, got to reduce the impact on your feet. So this is the time where you're not going to be doing aerobics or jogging or jumping, no jump roping, things like that. You have to use tools, especially if you're out in the garden, and things like that, and apply a good lotion and massage that area. And a good lotion is one that doesn't have a lot of perfumes in it or a lot of colors in it. So there's a lot of good ones on the market or something that has a lot of lanolin or something of that nature in it. Okay. There are some other things that we can do. We can increase the B6, some corticosteroids. What can you do? You can try ice packs for 15 to 20 minutes at a time. Just don't keep your feet or your hands in ice the entire time. They have to come in and out. Elevate your hands and feet. Use antibiotic ointment, moisturizers. The best thing patients tell me to do is that you put that lotion on at night, put on a good pair of socks, and go to bed. Okay? Avoid tight, constricting clothing. Edema. Couldn't find a picture for edema, I'm sorry. That's the puffiness around your eyes. Sometimes you can get the increased abdominal girth, and this can result in shortness of breath and weight gain. So we do recommend that you do check your weight on a daily basis. If you see a large increase, if you see that you can actually put your fingers into your ankles or your legs, we need a phone call because we may need to give you some type of medication to help you get rid of that fluid. You can limit your salt intake, weigh yourself to be sure that weight isn't going up drastically, and then just be alert to the changes in your body. Watch those rings on your fingers. Are they getting tight? Can you move them back and forth? Are you moving adjusting your watch band? Things of those natures. Muscle cramps. They can occur in the hands, the feet, the legs. They're usually occasional in nature, but they do seem to increase with prolonged therapy. So some of the hints for this is to increase your oral intake, take a magnesium or calcium supplement, exercise regularly. You can also try things like tonic water without the gin before bed. Now, I realize tonic water is an acquired taste, so you either like it or you don't like it. If you really can't tolerate it, then you can also try a glass of Gatorade. Now, there is also the old theory out there, excuse me, that a lot of people swear by, which is the ivory soap in the bed between the mattress pad and your top sheet. There is no medical reason why that works, but I know there are people out in this audience that have tried it and they do swear by it. It can't it works. See? Okay. It can't possibly hurt you, so it makes your bedroom smell nice. The only caution I'll put out there is that when you're doing your laundry, don't grab that soap because you will be in trouble in the wash area. But other than that, you can certainly try it. If it persists and becomes a severe problem, please let your team know, and we can help you with that. Sarah talked a lot about this, about the diarrhea, and I'm not going to really go over it. You can try yogurt. Sometimes that'll help. In this case, for the patients that want the caffeine, you might try to avoid caffeine. Try a brat diet with the bananas, the toast, the applesauce, and the rice, things of those natures. Take your anti-diarrheal medicines. Take your Imodium. It's available over the counter. If the Imodium doesn't work, then you need to call us so we can use prescription medications that are out there. There's Lomotil out there, and in some rare instances, we've even gone to things like tincture of opium. So there is help for it if you let us know. Like Sarah said, with loss of appetite, this is the time you schedule your meals. You cannot rely on hunger as your signal to eat. You eat by the clock, snack between meals, and watch the smells and things of foods. But food should be a pleasant experience. Nausea and vomiting. If you need drugs to take prior because the nausea and vomiting is at a point where you cannot eat or drink, let us know, because there are many that are available that can help you. But the major things is eat slow. Use a straw. Using a straw with beverages helps to reduce the smell and sometimes makes them more tolerable. I've heard that's why they use the straws down in CAT scan, making the barium, I guess if they can, make that more tolerable. Popsicles, find out what's better for you. Salty foods, most patients find salty foods, crackers, things of that nature help. Avoid dehydration, avoid that empty stomach. If that stomach gets empty, you're going to have more nausea. Low blood counts can occur, and this is why you will have scheduled routine blood work. And on that, we are checking, are you anemic? That you may require a blood transfusion. Are your white cells low? Are you more susceptible to infections? Are you running any fever? These things can make you tired, and there are things that we can do to help with that and to help prevent it. We may need to change the dosage of your drugs. Low platelet counts. When your platelets are low, your blood is not going to clot properly. You will bruise easily. You may have red dots under your skin, which we call petechiae. You may have gum bleeding. It's very important if your platelets are low that you not use any type of suppositories or enemas. And at that time, we would tell you not to do contact sports, especially bungee jumping. All right, I think we've moved to the question and answer phase here.
I had a question. I was wondering, I took Gleevec. Do you know of any reported side effects as far as like your teeth or your enamel? Do you know of any reported side effects for that?
I'm not aware of any. Dr. Trent?
Wouldn't Dr. Trent like to join us
Yeah,
up
he
here?
needs to join us. I have not heard of any.
Oh, okay. I was just wondering. Maybe it's just what my dentist is telling me.
To get you to come in regularly for your
Yeah,
checkups.
that's what they keep saying.
No, I mean, anything.
Yeah.
You know, we don't know. Gleevec really is, it's not been on the market that long when you think of
Yeah.
other drugs. So it could potentially have side effects that we don't know about. So just good oral hygiene is something that you want to do anyways, because you want to prevent any kind of infection, you know, or an abscess tooth or anything like that may, you know, have to stop taking your medication.
There are some studies that have shown that in some patients, and this is a small number of patients, not all patients by any means, but in some patients, Gleevec causes significant calcium and phosphate wasting through the kidneys. It's a very small number of patients, but there have been a few patients reported that had osteopenia and had some thinning of the bones. It's a small minority of patients, but it may, you know, if your dentist notices that your enamel is getting thinner, then that might be something that you would want to treat either through calcium supplements or, you know, having your dental checkups like Sarah mentioned.
Yeah, and it's something I know from as a child. I know that my mom, when she was pregnant with me, she had her appendix ruptured. So I know that there were complications there as far as the production of my enamel and stuff like that. But I didn't know if there had been any type of study or anything that had come out on Gleevec. So, thanks.
Go ahead.
My wife has nausea. It's episodic. It doesn't happen every day. But a couple of questions. You alluded she takes the 100 milligram size. And I was unaware that there was any iron in the pill. She's probably finished her iron now as far as replacement goes. She's far enough along. But the question occurred, she's on the 5-year study. The question occurred to me whether spreading the dose out instead of taking 400 milligrams at a time might be beneficial to her nausea. And when you raised the question of iron, the other question I had, she takes 100 milligram tablets. Do you see less nausea with 400 milligram tablets because of less iron? I'm interested in that.
I don't believe so.
Is it okay under the study protocol to take it, spread it like 200 in the morning, 200 in the evening? Right now she takes it all in the evening. Do you know, John?
Yeah, that's fine.
Okay, thank you.
In fact, that is one of the recommendations that we had made if nausea really becomes a problem with the 400 milligram tablet is to, again, have the 100 milligram tablets and, like you said, break that up.
Yes.
Do you categorically rule against slow FE or try it, and if it doesn't seem to be effective, then maybe you
I
have
think
to
it depends on the type of surgery that you've had. If you've not had surgery where your stomach was not affected.
Stomach especially.
I'm sorry?
Stomach especially.
Yes. The Slow FE actually is a really good tablet to take because of the slow release of the iron. You have less problems with the nausea that you can have. So if you haven't had any of your stomach resected, then yeah, I would recommend Slow FE. It's tolerated better. And again, with some orange juice, so a little better absorption.
I had a question. I wanted to know, I'm scheduled to go on to get intravenously, I guess, Zometa, and I wanted to know how that goes with Gleevec. Is that okay? Is there any side effects with taking those two things?
Yeah, it's fine. You can take it.
I wanted to ask a question about the muscle cramps. You say muscle cramps and also bone pain. And my question is, I have a few episodes of some type of pain, very sudden, around my, back, almost, under my breast area, and almost radiating down to my hip. And it happened to me a few times, and I kind of dismissed it, thinking maybe, I was just tired or whatever. But have you ever heard of something like that? Just kind of muscle spasm or?
I just think you need to discuss that with your physician.
Okay.
Mainly what we were referring to, or I was referring to in the talk, is more like a Charlie horse. You get them in the back of your leg right before bed or when you're in bed at night. You're typing on the computer and your hands just freeze. Those are the more common things that we see.
Yeah,
But if any unusual, symptoms like that, I would discuss with my healthcare team.
Especially if they're persistent.
Right.
So if you notice it, you kind of want to maybe jot down what you were doing before, during,
Right.
after, things like that. But again, if it's persistent, it's once or twice, there's, good time in between, then most likely it's not anything. But it's those things that are persistent that you want to talk to your team about.
And one other possibility, we know from the ACOSOG study, where half of the patients had placebo, that there are a lot of side effects that are related to having had surgery. So sometimes patients, when they have surgery, get scar tissue in their abdomen. The surgeons call them adhesions. And they can cause very strange feelings of discomfort in the abdomen. And if they're high up near the diaphragm, it could easily be feel like it's coming from underneath your rib cage.
Yeah.
Or it can even, if it's affecting the diaphragm, it can even radiate to your shoulder. So some patients will get shoulder pain sometimes because of an adhesion or scar tissue from a prior surgery.
Yeah.
So that could be a possibility. It sounds more like that than the type of Gleevec cramping that we see, like Pat said, is usually in the extremities.
Yeah, I had all that, my
Yeah.
back and the shoulder pain, and my stomach. I cannot eat as much as I used to.
Yeah.
Not from the surgery, because I had my surgery a year ago, but for the past couple of months,
Yeah.
I just cannot eat as much as I could.
And sometimes these adhesions form late. So they start getting worse as time goes on. So you may not even notice it for the first year because they're very slow forming. And so they can slowly get worse over time. So it's a possibility. I'm just putting that out there as a possibility.
Thank you.
I got a question. I had a partial resection of the stomach and lower esophagus, and I was put on Reglan and Protonics. But the information sheet I get from the pharmacist with the Reglan says not to take it for more than 12 weeks.
Right, and there's also the commercials with the contact your lawyer, that if you've been on Reglan.
Yeah, right.
So, so, in working in palliative care, we use Reglan on a regular basis, and we've used it long-term, and we don't if you're gonna see side effects, my experience has been it's usually right in the beginning when you take it, if you're gonna have problems with, I guess, the anxiety, kind of restlessness, type problems. But Reglan is a good medication. One, it's cheap. Two, it works well as an antiemetic. It doesn't make you as sleepy, and it helps to keep the gut moving. That's the other benefit, is it kind of helps to keep things moving. Zofran, which is another medication y'all probably heard of to take for nausea, very good for chemotherapy induced nausea, but causes constipation. So Reglan, long-term use, I've not seen a problem with. Now, again, we'd like to try to get you on as few medications as possible. So it may be that doing a trial and seeing, how you do without Reglan too is good. I think, in the beginning that it's important, but you may be past the point of needing it now.
Yeah. Well, I have already stopped it.
Okay.
But I didn't know whether to start it back. I can't tell much difference, really.
Okay.
There you go.
Thank you.
Okay.
Any other questions?
I looked up there when you gave, no things you shouldn't take for certain drugs. Just as a note, I know on my Nexavar, in the booklet they gave me, it says no orange juice, but I'd never seen the no garlic before. I mean, I'm, trying to figure out what to eat. I'm just, is that a new one, or? I didn't see you had no orange juice on yours, but that's a big one in my booklet, so.
There are many dietary and drug, I could only cover, the top ones. So you have to go by what your team tells you, what your pharmacist tells you. They also know what other drugs that you're taking. There's a whole list on the website of the drugs that you can and cannot take with Gleevec and all your other drugs. I couldn't possibly put them all on one screen. I mean, it would go on forever and ever. So it's something you just need to discuss with your team. Yeah.
And I think when you're talking about garlic, it's more
Yeah.
like the supplement.
And, yeah.
So have garlic in your diet.
Yeah, in your food, it's fine.
That's fine, but it's the taking of
Pills.
the supplements.
Yeah.
I got a question here. Fatigue is obviously very common, and it also sounds like it's very personal. Is there any sort of general coaching on how anxious anybody should be to get it treated or not, or just suck it up, as somebody said once?
Well, that's the problem, is that you can't suck it up because it's not your fault. So from a very personal perspective, fatigue is hard to admit because it means that we're weak. And you don't like that feeling, or that feeling of helplessness, as well as being tired all the time depresses you. So in coaching, I think you have to, one, admit that it's okay and that there are things you can do about it, but like Pat was talking about, you have to prioritize some things, and it may be that you're just not going to be able to do the activity that you used to do. So again, you prioritize, like she said, not sweeping the kitchen floor. I have 2 dogs, so I'm sweeping all the time. But, you have to learn about what's important and what's not. And you also have to give yourself a break, okay?
I'm thinking more about asking for treatment or not asking for treatment. That's more of the coaching.
Yeah, well, you have to also look at, too, what is making you fatigue. If it's your anemia, then, yeah, there are some things we can do about that, and definitely that's something that should be done. But also, too, fatigue sometimes can't be treated medically, and so you do things psychologically for yourself, and it really, exercise is, it really does amazing things for you, but it just wears you out thinking about it. So you need to just really give yourself a break, not to suck it up. I think you do that already too much, and it can really interfere with your treatment. You sometimes, well, not sometimes, you get tired of this, okay? And so again, thinking about putting another pill in your mouth. So we want to try to avoid situations like that. So fatigue actually can be a really serious issue. We have a fatigue clinic here.
We do.
So if that is a symptom that you're having problems with, and they've done the management of the anemia and things like that, then please feel free to ask to come to the fatigue clinic.
That's great coaching, thanks.
No more questions? I guess we have a break.
Okay.
Well, if there's no more questions, we have another break for a little while, and then at 4:15, we'll come back and have our last presentation.